Good day, ma'am. My name is San Castillo. Now I'm going to demonstrate the subcutaneous injection. So subcutaneous injections are highly effective in administering medications such as insulin, morphine, and gosirelin. So now we're going to check the doctor's order to give the right order to the right patient. So we have to give insulin to the patient who have diabetes. So then check the medication against the record AMR. So, insulin. Okay. Then, check the label on the medication carefully against the AMR to make sure that the correct medication is being prepared. So, then, follow the three check for administration the medication. Read the label of the medication when it's taken from the medication before withdrawing the medication and after withdrawing the medication. So now we're going to organize the equipment to save time and effort. So we have the alcohol, gloves, insulin vial, then cotton balls and syringe. Then now we're going to perform hand hygiene and observe the appropriate infection prevention procedure. So to deter the spread of microorganisms. So I'm done hand washing. So now we're going to provide the client's privacy to ensure that the cooperation of the client. So ma'am, I'm going to close the door. Ma'am, is it okay to you? Okay, thank you. Then prepares the client. Prior to perform the procedure, introduce yourself and verify the client's identity using agency protocol. So, hi ma'am, ako dahil si Pebbles Ann Castillo, imong students nurse karong adlaw. So, pwede ba na ako mabalan ang imong pangalan niya imong edad? Palihog na lang po ko sa wristband ma'am ha. Okay, thank you. Then, assist the clients to a position in which arm, leg, or abdomen can be relaxed depending on the side of the wheels. So, ma'am, pwede rin ka mag-igda, ma'am, ha? Kaya para, injikan sa kadili sa imong tiyan. Okay? Then, obtains assistance in holding an cooperative client. Since my clients naman is behave, so okay lang naman. Then, explain the purpose of the medication and how it will help using the language that the clients can understand and include relevant information about effects of the medication. So, ma'am, natin ko diri para maghatag og tambal sa insulin. Kani siya para pambababa sa imo og blood sugar. So, okay lang ba si mo, ha, ma'am? So, ma'am, nani mga side effects, ma'am, ha? Okay, sige, salamat.
So now we're going to select and clean the site. So I'm choosing the lower abdomen to put the medication. Then select a site for free of tenderness, hardness, swelling, or itching, burning, or localized inflammation. So select a site that has not been used frequently. If you notice this one, you can find another site to inject medication. So now we're going to apply clean gloves. So I'm done applying clean gloves. Then, as agency protocol indicates, clean the site when an aseptic swab start as the center of the site and clean it a widening circle of the 5 cm. So now we're going to place and hold the swab between the third and fourth finger of the non-dominant hand or position the swab on the client's skin above and the intended. Then prepare the syringe of injection. Then, so before that, we have to then prepare the syringe. Then remove the needle cap while waiting for the antiseptic to dry. Then pulse the cap straight off to avoid contaminating the needle by the outside of the edge of the cap. Then inject the medication. Then grab the syringe in your dominant hand by holding it between your thumb and fingers. Then while palm facing to the side of upward for a 45 angle insertion or with the palm downward for 90 degree. Then using a Dominant hand, pinch the spread of the skin at the side. Insert the needle using the dominant hand and a firm steady push. Then remove the needle while waiting for the antiseptic to dry. Post the cap straight and avoid contaminating the Then, grab the syringe in your dominant hand by holding between your thumb and fingers by palm raising forward to 45 angle. Then, inject the medication by holding the syringe steady and depressing plunger with a slow even pressure. Then, remove the needle. Removing the needle, smoothly pulling along the line insertion while depressing the skin with your non-dominant hand. If bleeding occurs, apply pressure to the dry, stealing gas until the stop. Then, dispose of all supplies needed. Then, assist the patient into comfortable position. Flip the pundication ticket if not using enough. Okay na, ma'am. Then, do aftercare. Remove the gloves. Dispose use turn items in appropriate receptacle. Return other equipment to. Then, perform hand hygiene. Then, assess the effectiveness of the medication at the time it is exposed. So now I'm done hand hygiene na. So, kamusta man ka, ma'am? Wala ba kailangan gibati? Sige. So, now document all relevant information. And that's all. Thank you.